Hi everyone, I'm Dr. Priscilla and I'm an optometrist. You might have noticed that if you go into optical practice and you want to purchase contact lenses, they'll ask you for a contact lens prescription. So having a glasses prescription doesn't automatically qualify you to get contact lenses because these are two completely different things. You need to specifically have a contact lens test with your eye doctor first. You might be wondering why this is the case, and it's not because we want to make life harder for you. Contact lenses are a medical device that needs to be fitted properly on your eyes. And there isn't a one-size-fits-all option because contacts and eyes come in different shapes and sizes. And there are also different materials of contacts. It's like if you tried on the same size of pants from two different brands, they won't fit the same. One may fit perfectly while the other may be too tight on the hips but fits well on the legs, or it can just fit totally wrong. And it's not just the clothing, but even two people who wear the same clothing size will come in different body shapes and proportions. What's easy with pants is that you can actually see if it fits well in the mirror, but with contacts, you need your eye doctor to check that. Overall, we don't want your contacts fitting too tightly or too loose. If it fits too tight, it prevents oxygen from getting to your eyes and can cause problems to your eyes like neovascularization. And this is when you get new blood vessels forming on the cornea, the front surface of the eyes, where there shouldn't be any blood vessels. You can also get corneal ulcers, which can potentially lead to blindness. If contact lenses are too loose, that's not good either, as it causes discomfort because you can feel the movement and it can cause variable vision when you blink. Or the contact lens can actually even fall out of your eyes. So we need it just right, whether it's for prescription contacts or non-prescription contacts or colored contact lenses. Because you might not feel the difference on your eyes. And there are also different contact lens materials. So back to the pants analogy, pants can come in cotton, cotton blend, synthetic, silk, linen, and so on. With contact lenses, some materials are more breathable or have newer technology that is healthier for your eyes. And in order to get the best vision in your contacts, the power in it also must be checked. And the contact lens power may not exactly be the same as your glasses. And this is because contacts are a device that sits directly on the eye rather than 1 centimeter away from your eyes like your glasses. This distance may be small, but it affects the power required to focus light to your eyes properly to get clear vision. So when you go see your eye doctor, they will prescribe you with lenses that are a healthy and compatible material with your eyes and that fit right, as well as adjusting your script power to give you your best optimal vision. So why do you need your contact lens prescriptions updated regularly? Can't you just use the same one? So contact lenses are a medical device, as I mentioned, and therefore requires an up-to-date prescription, which can only be prescribed by your eye doctor. And the eye test isn't just to see if your prescription has changed, but also to ensure your eyes are healthy to continue with your lenses and to screen for contact lens related issues as well as other eye diseases like glaucoma and macular degeneration. And because our bodies and our eyes are continually changing, it means that one type of contact lenses may not work for you for life. And if you've never had any complications with your lenses in the past, it doesn't exempt you from issues in the future. In the end, we want to prevent contact lens complications from happening rather than waiting for it to happen and try and fix it. So what if your optometrist doesn't carry the lens you want to use? So if you have a certain brand of contact lenses you want to try and your optometrist doesn't stock it, there might be a reason for that. In Australia, optometrists will only prescribe TGA-approved contact lenses. Some online brands may not be TGA approved and may contain harmful chemicals, and it is common they use older technology material that do not allow your eyes to breathe, which will cause long-term issues with a lack of oxygen reaching the eyes, also known as hypoxia. You may have heard horror stories of people getting severe infections or have gone blind from wearing certain Halloween lenses. Talk to your eye doctor and see what their thoughts are on the brand that you're interested in. If they are happy with the material and the manufacturer, they might be able to assess the fit of the lenses for you. So where should you purchase your contact lenses? After you get your prescription, where you purchase your contacts is also something to consider. I would advise not to purchase your contacts from a non-reputable place. Places that you might want to stay away from are costume shops or small kiosks, beauty shops with colored lenses, or places online you can order without a prescription. There are certain sites that send you your contact lenses without verifying your prescription with your optometrist. Although this may sound convenient for you, but it doesn't seem like these places are putting your health first, and they may be putting your eye health in jeopardy. So how often should you get your contact lens prescription checked? How often you need to do this will depend on what type of contact lens you're wearing, and as well as your eye health history and track record of infections. Generally speaking, scripts may be valid for 1 to 2 years. Now you understand why you need a contact lens prescription and a routine eye test to update them. Trust me, it's not because we're trying to make life difficult for you. We just want the best for your eyes. If you found this video helpful, hit the like button and subscribe and hit the notification bell so you don't miss any of our new videos answering your common eye questions. Thanks for watching.